Hi, my name's Katie Worthley. I'm a student in the BSN program. Here's my license. I am going here today to do a assessment on a patient. My patient here is a 21-year-old male. Could you state your name or verify your name and date of birth, please?
Charles Sanchez, 6/12/89.
Thank you. And are you okay with me doing a assessment on you? Okay. Very good. So we're just going to go through some basic background info. So you do have a diagnosis of diabetes. That's kind of what brought you in today. You were having some problems with your blood sugars and whatnot. Could you give me your allergies? Do you have any allergies?
Azithromycin.
Okay. And do you have any other diagnoses? Your history, like in your family, anything? Any other people with diabetes?
Yeah, my grandmother.
Your grandmother. Okay.
Yeah.
Are you up to date on your vaccinations? Have you had your flu vaccine? Yeah. Okay. And pneumonia vaccine, which you're young for, because that's usually at 50.
Yeah.
And do you also give consent for us to perform this assessment? Very good. All right. So we're going to. My name is Katie, the nurse, RN. I'm going to provide privacy and wash hands. So we already started, did your vital signs. Your respirations were 18, which is perfect. Pulse was 76, which was great. Blood pressure was 121/78. Temperature was 98.1. And your oxygen was 98, so that's great. And what is your height?
5'6".
5'6", okay. And how about your current weight?
215, roughly.
Thank you. All right. So we're going to start with your head. We're just going to check. We're going to assess the head. Check the skin color. Color looks great. We're going to check for We're going to check the head, the hair, for any lesions or any bumps or anything like that. Also, any infestations, which I don't see anything. We're going to check the beard. I also don't see anything. We're also going to palpate for crepitus, anything out of place or anything that may be moving. And then we go down. We want to inspect the eyes. Next, we want to look for, ask you to, we're going to check for cranial nerve 7. So go ahead and can you open and close your eyes, please? Thank you. They look great. I'm going to check the sclera and the pupils to make sure they're both symmetrical and they both look fine. The sclera is white. Also check the conjunctiva to make sure there's no yellowish or no swelling. Can you go ahead and pull your eyelids down? Thank you. You want to check the eyelids, make sure there's anything, and they look great. You also want to check to make sure the eyes are equal. And then you want to take your pen light. This is actually simulating a pen light. If you can just follow pen back and forth, up and down. I'm just going to come in from the side, just to check to see if the pupils are the same. And they are. Very good. So that's Perla, pupils equal and reactive to light. We also want to use to check for cranial nerve number 2. We want to use the Snellen chart. I'm going to simulate this. So about 20 feet away. Can you read the 5 letters down the bottom?
A, E, P, Z, V.
Very good. So vision's 20/20, so that's good. Then we want to we're also checking the pupil size to make sure they're 3 to 5 millimeters in size, and diameter is good. It's normal. We're checking for accommodations, so just follow the pen inward and then out. Thank you. And that's actually checking for cranial nerve number 3, 4, and 6. We're then going to check the face. We're going to palpate the sinuses. Do you have any pain there?
Nope.
Do you have any pain here?
Nope.
Any pain over here?
Nope.
Can you smile? You want to look to make sure both sides are symmetrical. I don't see any facial drooping. So that's a good sign. That would be an indicator of potentially a stroke. I don't see any facial drooping. Sinuses are good. You then want to go to the ears. Have you had any ear pain? You want to inspect for any redness, drainage, or pain. Which I don't see any on that side. And I don't see any on that side. Very good. You're also looking for what's called a tophi, which could be like a yellowish bunch on the outside of the ear, which I don't see any. More likely in the elderly folk. I'm going to palpate the mastoid process behind the ear. Do you have any pain back there?
Nope.
Any pain back there?
Nope.
Okay, very good. I'm also going to do, for the cranial nerve number 8, I'm going to whisper 2 words, and I'm going to occlude your ear on one side, and just repeat the 2 words that I say. Dog and cat.
Dog and cat.
Same on this side. Apple, banana.
Apple, banana.
So hearing is good. And then I'm going to simulate using a otoscope to look in the ear at the tympanic membrane. You want to make sure, you want to hold the pinna up and back in adults, up and back, and look at the ear to see if it's pearly gray, and to see if you see any abnormalities. And next we're going to go to the nose. What you're looking for with the nose, is it midline? Do you have any drainage? Do you have any pain? Any stuff? Nasal congestion?
A little bit of congestion.
Little congestion, okay. Have you had a cold recently or anything?
No.
No, okay. Any drainage that's like green, yellow, mucousy? No, okay. I'm just going to occlude one nostril at a time. Can you breathe okay?
Mm-hmm.
And on that side?
Mm-hmm.
Okay, very good. And I'm going to take a look up your nostrils. Looks good. Little congestion, but nothing. But a couple days will fix. You're also looking for redness at this time with the nose. The next would be the mouth. I'm going to do hand hygiene. I always use gloves with the mouth to inspect because you're dealing with bodily fluids. So what you want to look at just externally is the lips to see if they're chapped, see if they're pink, moist. If they're dry, cracked, it could be a sign of dehydration. Can you open your mouth, please? And I'm just gonna, can you move your tongue from side to side? What you're looking for is any oral lesions, anything that could be in the mouth. I'm going to take this tongue blade and just say ah. And look down the throat to see if you see any redness. Any whiteness on the tongue, which could be a sign of thrush. And you're also checking for a gag reflex. I'm going to simulate this. But you would take your stick and put it down the back of your throat to see if you have a gag reflex. And can you go ahead and puff out your cheeks? You want to check to make sure they're symmetrical. Looks good. And now we're checking, for your throat. Can you go ahead and swallow? If you don't mind. Thank you. So you're checking for the swallow reflex to make sure that's intact. And the cranial nerves 9 and 10, you're checking for gag reflex, and that would be using the tongue blade. So then, take these off. And we'll just do hand hygiene. Then you would want to go to the neck. Can you go ahead and tilt your neck up and down for me and side to side? Okay, looks good. You're actually checking to make sure the trachea is midline, which it is. You're checking for any lumps, and I don't see any lumps on the side. Very good. You're also checking, can you turn your head to the right? You're checking for JVD distension, which I don't see on that side. If you could turn to the other side. Yep. JVD looks good. Do you have any any pain or anything when I push down? Nope. Okay. You're also checking the carotid artery on both sides. And that's a bounding +2, 2+. And you also want to palpate the along the neck for the lymph nodes to see if you feel anything. Okay, and then you also want to palpate for the lymph nodes down here and down here, and everything looks good. You're looking for small lumps that may be hard or soft, movable, that type of thing. Then we go to the upper extremities. I'm going to look at your arms. You're looking for color, temperature, sensation. Check the back and the front. Check the palms, in between the nails to check capillary refill. It's less than 3, so that's good. Can you move your arm up and down and then side to side? Very good. And then the same with this one. Check the front, check the palms, check the nail beds. They look good. You're looking for any, if there's yellow or jaundice or anything like that. You want to check for the nose as well, because that osteoarthritis, they could be inflamed. Also on here, cap refill is less than 3. You also want to check for temperature of the skin with the back of your hand. Can you move your arm up and down as well? Very good. And then we're also going to check for skin elasticity. Just grab up. So he has very good skin elasticity and turgor. You also want to check for the brachial artery on both sides. Very good. We're also going to check the radial artery. Very good. And then one other test, can you hold your arms up and close your eyes? You're actually checking for any drooping, which is another sign of a potential stroke or weakness. And you can put your arms down. All right, so then next we would assess the chest. So just for purposes, the patient would have the shirt off. We're looking for any chest lesions. If you could actually stand up And if you're looking at like a COPD patient, they could have a barrel chest. So looking midline, everything looks good, looks symmetrical. Okay, you can have a seat. You also want to take a look at chest rise and fall. Is it equal? Is it equal rise, equal fall? And then we go on to the heart. You want to listen to the 5 heart sounds. You're looking for normal sounds of S1 and S2. We're going to be looking at the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And you also want to listen to the apical pulse for a full minute. So let me go ahead and do that. Very good. You're also checking for any heart murmurs or anything of that nature when you're assessing the heart. Do you have any heart problems that run in your family or anything of that nature? No. You're also, last thing would be checking for lung sounds. You always check from side to side. You're listening for crackles, wheezes, strider. Start at the apexes and work your way to the bases. Alright, and you're also looking again for chest rise and fall to make sure it's equal and make sure there's no problems. And the last thing is doing tactile fremitus on the back. I'm going to touch you on the back in 3 places. Just say the word 99. So go ahead. 1, 2, 3.
99. 99. 99.
Very good. And that is the end of our assessment. I appreciate your time and thank you.
You're welcome.